My name is Marie Catherine Lee. I am a surgeon at Moffitt Cancer Center. I specialize in breast cancer surgery. As a surgeon, my day-to-day is different every day. On the days that I am not in surgery, I generally see patients in the clinic. Most of the patients that come to see me have been informed that they've been diagnosed with breast cancer. They've had usually some testing done. Some of them come to me after having seen 2 or 3 or 4 other doctors and with armloads of questions. I think that one of my primary goals in seeing a new breast cancer patient is to give them a plan, but hopefully to allay some of those fears, to give them some comfort and to put into perspective what it is that we're dealing with. I think that Moffitt is really unique because I don't think I've ever worked in a place, and I've worked in a lot of places in a lot of parts of the country at this point, where the faculty, the staff, even the people that work in maintenance, clean the floors, people really go out of their way to do what they can. I have a lot of memorable patients. There is one that I saw just this week that really stands out in my mind as an inspiring human being with a particularly remarkable story, because she came to me with a very high-risk, complicated pregnancy and what we would consider a fairly high-risk and concerning breast cancer. And just this past week, she hit the 5-year mark, and I gave her a hug, and she said to me, did you think when you met me 5 years ago that this is where it would be? And I said, yes, 100%. I have another young patient that is still under my care who I think embodies resilience. She really, despite multiple cancer treatments, starting at a very young age and then breast cancer treatment under my care, has really demonstrated a level of personal dignity and courage that I've never seen in anyone else, and in somebody so young, not even 30. And despite all of the hardships, cancer treatment, multiple cancer treatments, sometimes bad news, sometimes a lot of treatments that are very difficult to deal with, and then her own personal and family struggles, she always, even at the end of a very difficult conversation, turns to me and says, I'm gonna be okay, which is amazing to me. Despite all of her hardships, she's really somebody that sort of embodies the reason why I do what I do and why I love what I do, because to support somebody like that is a privilege.